when Just Recovery Simcoe started to work with amongst our 40 member groups, and we started to talk about different ideas and things that could go on, and we went through the list. It was really interesting how there was a lot of co-benefits to things. You know, if you build a road, okay, you build a road, you also lose a lot. Oh, there she is. I've shipped my kids off for the night, so I don't have to worry about that for today. But you know, when you build a road, the impacts of that road, the positive impacts, are limited to a select few that can drive, that are going to be traveling that road. And of course, then you have the externalities, negative externalities that Dr. Howard talked about. When we started to go through the list, it was interesting that some of the municipal response was, yeah, but we're dealing with COVID. We can deal with climate afterwards. And we're talking about things like, you know, green infrastructure investments mean a lot. Changing land use planning policies so that they're more equitable. Putting in like sort of things that everyone goes, yeah, but that's dealing with climate. We're trying to deal with COVID. And you're like, actually, you can come up with solutions that bring the best of both of those things, that you can deal with inequity, and you can deal with municipal financial constraints, and you can deal with COVID, and you can deal, you know what I mean, with, not that there's a silver bullet to any of it, but I think sometimes it seems to me, and I'd like to see what you guys think of it, it seems to me that there is this compartmentalization. We can only deal with one problem at a time. If you want to fix the penal system, then you get more correction officers, or you put more money into it. If you want to fix education, it's almost like we just tend to throw money at it, but forget that there's maybe other solutions that are outside of what we determine as a solution, or used to seeing as a solution, that actually has much stronger, healthier co-benefits for other things. Am I off on that? Do you feel that the governments are like more broad, or do you still think they're compartmentalizing as I see them? Randy?
Well, I mean, first of all, to go back to the very first thing Dr. Howard said, it's not like COVID is over, and it might not ever be over for all we know. We might have more pandemics. We've been expecting one for a long time, and just because we have one now that is going around the world doesn't mean it's going to be another 15 years. As gamblers say, the dice have no memory. Doesn't matter what the odds are, it could happen again. So we cannot just assume that we're dealing with COVID and then we'll get through that, and then we'll deal with these other crises. But I want to say to the politicians that say, oh, we're going to deal with COVID, then we'll deal with your problem. I think the correct response is, well, no, you won't. You weren't dealing with it before. You didn't care before. What makes me think that you care now, right? And I just really think that it has to be one integrated solution that's dealing with COVID and is dealing with the other problems as we go. Because if dealing with COVID takes 10 years, well, the climate situation is going to be, well, we all know it's going to be a chaotic disaster. So we can't wait.
Mm-hmm. Dr. Howard?
Yeah, I like this concept of multi-solving. I first heard Elizabeth, I'm not sure if I'm saying her name right, Sawin, discuss it, and she talks a lot about the health co-benefits. So it's a way to frame a lot of what we talk about in terms of the air pollution related health benefits and healthcare cost savings associated with phasing out coal-fired power plants and that kind of thing. Or active transport, cycling actually reduces mortality. There's almost nothing that I could do that decreases mortality. Although I did just read a study that shows that electing more female decision makers in Canada has been associated with decreasing mortality. So I thought that was kind of interesting. I'm like, oh, it goes in the same very small basket as cycling. That's cool. So yeah, I think we have no option but to solve both at the same time. And there's no reason not to either, because there's so many solutions that just move us in the right direction. But I really do think, I've been working with Trevor Hancock, who is a major planetary health and public health thinker in Canada, and really pretty serious about this idea of like, how do we maximize the number of places where we can connect budgets so that people at least know about the impact on somebody else's budget by an action that they do, and somehow get credit for it. Because I think that's so much for future benefit with things that seem like a cost now. But I I do think that we need to change the overall structure, because otherwise we're just not going to be there if we've only got our eye on GDP. I really properly think that this is a moment where we need to move to a New Zealand style well-being based economy, use some of the Canadian index to inform a made in Canada version. And I think that that's pretty critical, because otherwise and you know, in the emergency department, if you're resuscitating something, you always know what your outcome is. You know, you're like, I'm targeting a blood pressure, you know, systolic blood pressure of 90, and that's what I'm resuscitating to. I'm not convinced right now that our policymakers are like, what's their goal? What is their goal? How are they measuring their progress? And so therefore, how do you make the risk and benefit decisions of your various decisions?
Mm-hmm, mm-hmm. And one of the things that Just Recovery Simcoe did when we were kind of working together on this letter was to really focus on the social determinants of health. And we felt if you made budgetary decisions based on equity and the social determinants of health, that's a really good foundation. So I'm assuming that both of you would agree with that, focusing on recovery, focusing on dealing with climate starts with those two basic principles. What kind of initiatives would you hope to see, what were some initiatives that you would hope to see that would come out of an equity and a well-being first perspective?